Hello, I'm Rachel Cackett. I'm the Chief Executive of the Coalition of Care and Support Providers in Scotland, and I'm going to take a little bit of time today to talk about our view on the newly passed Care Reform Bill in Scotland. We have been supportive of a really radical change in the way that care and support is delivered in Scotland. We're in desperate need. We've got a sector of providers who are really struggling to make ends meet on the basis of public sector grants and investment in the sector. And we've got supported people and their carers at home who are also really struggling. So let's just start by saying reform is desperately needed. And this bill in and of itself isn't going to do that. But I'll take my hat off to last minute scrambling, I think, by MSPs to try to make something more of this bill than we thought was possible. And some important things have been put in, which I would say in and of themselves are not reforms, but they're an open door for us to push to try to get the sorts of reforms we'd always hoped for. So they include, for example, changes to the way in which services from not-for-profit organisations like those I represent in Scotland, the way in which their services are purchased by local and national government. One is a direct change which will allow some contracts to be reserved for not-for-profits, which I think is a really important step to ensuring that we're putting money, public taxpayers' money, into the right areas to deliver good results for people. But there's also a commitment now to publish guidance on what is called quite often now ethical commissioning. Derek Feely called it commissioning for public good. It's really about how do you take taxpayers' money and get the best out of it for people in local communities and families across Scotland. We had hoped that this bill would once and for all get to a point when really committed staff who are trained, who are registered professionally, who have to have PVG checks to make sure that they're able to work in the sector, are actually paid at an equal level to people doing exactly the same work in the public sector. So again, the bill doesn't actually allow it to happen, but what it does do is it means that the government will now have to produce a strategy on how it's going to deliver fair work in social care and report on it. Really importantly, report on it, including reporting on where it's not delivering and how it's going to make that better. The last big area I think that's really important, although it's quite a small amendment, is the bill itself said nothing around money. Now, one of the key things is that our sector has been historically massively underinvested in. And that's got us to the situation that we're in where people can't get the care and support that they need all of the time and carers are left picking up the pieces. But what has been put in at the last minute as an amendment is a report on essentially unmet need. What's future need going to be? Now, we think that's an important first step. It is only a first step to try to define what need for social care is, to allow those of us who are in the social care sector to be able to really make our representations to government to fund the sector properly, because people deserve no less than proper funding and fair funding for social care and support when they need it.